I'm David Wohl. I'm a physician. I'm an expert in HIV care. And I work at the University of North Carolina here in Chapel Hill, North Carolina. And I've been doing HIV work for about 20 years. So I'm really excited that you decided to listen to this and to think about getting tested for HIV. And that's what we're going to talk about today, because knowing your status puts you in control. It's incredibly important. And I know it can be scary to get tested for HIV, but regardless of the result, you have options. If your test comes back negative, there's medicines that can protect you from getting HIV if you're at risk. And if your test is positive, there are treatments that can make sure that the virus gets under control, that your immune system stays strong, and you can stay healthy. So knowledge is power. And knowing the results of your test will give you the power to protect yourself and to protect others. So who should get tested? And basically it comes down to most everyone should get tested once in their lifetime. I mean, really, certainly people who are sexually active or who could have been exposed to HIV through a number of different ways, getting tested at least once lets them know their status and they can move on. Certainly people with certain risk factors should get tested more often. And that may even include every year or even more often. Certainly we know how the virus is transmitted, and that's why we have to concentrate on folks who might be exposed. So sexually active gay and bisexual men, maybe more frequent testing would be important for them if they're having condomless sex. Again, it depends upon your risk. So there's a whole list of questions that you can ask yourself about, am I at risk? Generally, we know that the virus is transmitted from one person to another. So that's really key. And it's transmitted in very specific ways. So sexually, so without a condom, if there's been sex and one person could be positive and the other person could be negative, well, that's an opportunity for transmission. So sexual transmission is key, whether from a man to a man, a woman to a man, or a man to a woman, all different combinations. Anything you can think of, it's possible if you have genitals involved with other genitals or someone's butt, and people can get infected that way. The other thing we have to think about is non-sexual ways. And that comes down to sharing injection drug equipment. So like needles, syringes, even cookers. We do know that the virus can survive that process and be injected from one person to another. So if there's someone who's injecting and they always use clean needles, well, that's very different. That's almost like having a condom on during sex. So we just have to think about these things. We also know that there's some people who could be born with HIV, and that's if their mom was positive. But really, by and large, what we're talking about is risk that has to do with sex or with injections. So where to get tested? There's a lot of places people can get tested. Your local doctor might be able to test you, should be able to test you, might even ask you if you want to test. You can go to your local health department. There's testing sites, VA medical centers, substance abuse programs and prevention programs. There's STD clinics, family planning clinics. So there's a load of places you can go. You can even Google this online. And there's even home testing available for some folks. So the important thing to recognize about a test, and you probably heard about this, is there's a little bit of a window period between when someone gets infected and when a test becomes positive. That window period has shrunk really, really, really small. So for most of the tests we're talking about that are available, the time before someone becomes positive by one of these tests is on the order of days to maybe a couple of weeks. So none of this 6-month stuff that used to happen back in the day. What we know is that if you get infected, by about 10 to 14 days, using some of the tests that we're using now that are most commonly used, a positive test should result. Now, there's all sorts of things that can happen, some exceptions, but I think in general, based upon the test that you're using, you should expect that about 3 weeks after exposure, if you're going to be infected, the test should be positive. There's some sophisticated tests that can even detect HIV in a person's system within a few days of exposure, but those are more expensive, and that would be something you'd have to talk about with your clinician. So if you test negative, there are ways to protect yourself, like I said before. There's something called PrEP, or pre-exposure prophylaxis. Right now, that's a pill. And it's a pill you can take every day, 1 pill a day. Most people tolerate it wonderfully. And it really is extremely effective at preventing you from acquiring HIV. So it's like 99% effective. And really the problems that we see with it are when people don't take the medication like they should. They forget, whatever. So many people who use PrEP don't use condoms, right? Because they know they don't like condoms, so they're using PrEP, or condoms don't work for them very well. or it's just hard to integrate into their sex lives. So that means that PrEP is going to help them prevent HIV from entering their body, but it doesn't do anything to prevent other sexually transmitted diseases from being acquired too, like syphilis or chlamydia or gonorrhea or herpes or hepatitis C. So you should talk to your health provider about PrEP if you're interested in it, if you're HIV negative, and you could be exposed to HIV due to any sort of behaviors that we're talking about. Most providers will give you about a 3-month supply, check you for HIV every visit, check you for STIs, make sure that everything's okay, and continue that medication as long as you need it. Again, condoms with PrEP could be even better because it prevents both HIV and other STDs, and if anything happens like a condom breaks, the PrEP is there to prevent HIV. Okay. Knowledge is power. So again, what to do with a positive test? Well, knowing you're positive lets you take action. HIV therapies have come a long way. HIV therapies are powerful, but while they become more powerful, they've also become better tolerated. So that's a really great combination, really effective and really well tolerated. That means the vast majority of people who start in HIV medicine don't experience side effects that make their life miserable or make them stop the medicine. And if there is a problem, there's alternatives. We have lots of different HIV medicines to fit everyone's different profile and lifestyle. So the treatments work basically by stopping the virus from making copies of itself. So it's like birth control for the virus. And so if the virus can't replicate, the immune system in your body starts to attack it and get the upper hand. And that could kind of keep the genie in the bottle so that the virus is all bottled up and not bothering your immune system and keeps you healthy. The sooner people start HIV therapy, the better it works at preserving and improving the immune system. If people wait too long, there could be some damage to their immune system, and that might not be completely repairable. So it's really good to start HIV therapy as soon as someone knows that they're positive. The other thing that HIV therapy does is it makes the person uninfectious, or nearly so, meaning that if you're on HIV therapy and you get the virus all the way down to like a needle in a haystack in your blood, the ability to transmit that virus to other people is almost nil. And that's really important. We call that U equals U. Undetectable, meaning so little virus we could hardly detect it with our tests. So the virus is still there, but it's just at such a low level, means I cannot transmit it to other people. And we have really good science that shows that's the case. So all in all, getting tested is important. All in all, getting tested gives you knowledge, and knowledge is power. This is not the end of the information that you need. There's lots of resources. At this website, you could find more information that can help you stay healthy and safe. Thank you again, and take care.